Hello YouTube, half a day and mabuhay. As promised to you today, we will be discussing the pros and cons of getting pregnant in your 30s. In Western, Northern, and Southern Europe, the age at which mothers give birth for the first time has increased to 27 to 29 years old from 23 to 25 years old in the 1970s. In other developing countries, it had actually increased to 31 years old in Spain, Switzerland, Japan, and Italy. In the US, we see the same rate of increase from 21 years old in the 1970s to 26 years old in 2018. So the trend nowadays is that women are prolonging getting pregnant at a later age, some in their late 20s and some even in their 30s. I know that there are some of you there who are focusing more on your career at this point. Maybe some of you are in your late 20s, maybe some of you are in your early 30s and are considering starting a family sometime soon, or maybe that option is not yet available for you right now. So there are plenty of things to think about. It's not entirely bad. I know some people who do it in purpose. Okay, just like me, I did get pregnant first at the age of 36. So I belong to that medyo advancing maternal age group. At nung una nga ako nagpa-check up and I heard the term geriatric pregnancy, medyo na-shock ako. Medyo na-hurt ako ng very, very light. Pero that is a truth because when we are born, we're born with all of our egg cells already. Women are born with about 1 million egg cells. But as time moves on, okay, by the time that you hit puberty, do you know that it actually goes down to 300,000? However, all throughout the lifetime of a woman, the total number of egg cells that will mature, okay, and be released from the ovary is only about 400 to 500. It gives us now the ideal age to get pregnant to be around your 20s up to the early 30s, and then by mid-30s onwards, then that is when they say you're starting to have risks already. So there are still a lot of women who prefer to delay their pregnancy. So what are the pros and cons of this? Let's explore in this video. And syempre gusto mag-hi ni Ethan. Say hi! Say hi! For our first-time viewers, my name is Miss D. I am a Filipina who lives here in Guam, and I have a 1.5-year-old baby named Ethan. I am a nurse, a professor, and now a full-time mother. And we are about to share with you something that is very close to our heart. A woman's peak reproductive age is from their late teens to their late 20s. At this age, you have your best chances of getting pregnant. In your 30s, fertility would start to decline, and it declines more rapidly when you get to your mid-30s. By the age of 45, fertility has declined so much that getting pregnant naturally seems almost impossible for most women. Getting pregnant after 35 is also linked to a lot more complications. Let us talk about first the cons of delaying your pregnancy until your 30s. The first of which is decreased fertility. Ovulation becomes more erratic as the woman's body matures. The egg cells that a woman has declines both in quality and quantity with advanced maternal age. All of this could result to infertility, which means that it could take longer for you to conceive. The second con of getting pregnant at a later age is that there is a higher possibility for lifestyle diseases. The older you are, there are more medical conditions that could affect both you and the baby's health. Such conditions include thyroid problems, diabetes, high blood pressure, and an increased risk for premature delivery. Another disadvantage of prolonging your first pregnancy is the development of pregnancy complications. Because advancing maternal age could increase the possibility for gestational diabetes and high blood pressure, conceiving would be difficult but not impossible. However, you might need to follow a strict diet plan, exercise, and possibly more frequent visits to your OB. Advanced maternal age is also associated with an increase in your chances of delivering by cesarean section. Just like me, in my personal experience, I've planned for a natural delivery. However, during the time of my labor, my son's heart rate started dropping and they couldn't control it anymore. That's why my OB opted for an emergency CS. Pregnancy in your 30s is associated with difficulty in labor and sustained labor pain due to the following issues. That number one, it's possible that your cervix is not opening properly, or number two, the baby's movements are not right, or thirdly, the contractions are not powerful enough to get the baby out. Advanced maternal age is also associated with higher risk of miscarriage, stillbirth, and unexplained fetal death. Delaying getting pregnant can also cause chromosomal abnormalities that could greatly affect the health of your baby. For pregnancies in your late 30s, it is associated with low birth weight and genetic problems such as Down syndrome and spinal cord defects. However, in order for you to know whether your baby has this or not while you are pregnant, your OB can order tests such as amniocentesis and regular ultrasounds. So before it starts to sound really scary, getting pregnant in your 30s is not all that bad. It also has a lot of pros. Research has shown that getting pregnant later on in life, specifically in your 30s, could lead to a more stable family environment, higher socioeconomic position, higher income and better living conditions, and better parenting practices, including better disciplinary methods. One of the biggest reasons why women choose to have their children in their 30s is because of financial stability. Studies show that these women who first give birth in their 30s are usually, one, those who have college education, those who have achieved higher in their career ladder, they are more settled, or they are older, wiser, more capable of handling money and making better financial decisions. Another pro of getting pregnant in your 30s is that these women have enhanced emotional preparedness for parenting. What this means is that usually at this point, women has greater relationship stability with their partners. The chances are in your 30s, you will be in a more stable, healthy relationship as compared to those who rush into getting married and getting pregnant in their 20s. Also, women who delay getting pregnant in their 30s do so because they want to give the relationship with their now husband maybe a couple of years to settle down, get to know each other first, get to know how it feels like living together first before they decide to have their first child. This is because in the initial few years of getting married, it's usually a period of adjustment. It is associated with higher stresses due to the difficulties of adjusting with each other in your new married life. Also, if you get pregnant in your 30s, they say that you are already more experienced. What does this mean? Imagine if you get pregnant in your early 20s, if you come to think of it, you're only a little bit older than a child. Those who are in their 30s are more matured, they have traveled more, they have worked, lived, and gained more experiences in life. Researchers have shown that they are wiser, calmer, and they can provide more support for their children. Another pro of getting pregnant in your 30s is that you have a better support group. Usually, if you get pregnant in your 20s, not many of your friends already has children. So you can't really go to them and ask them advices or help regarding how to raise your child. If you have any concerns or questions about raising children, it is difficult for someone in their 20s to go to friends of their same age, especially if your friends also are waiting later to get pregnant. So in that case, women in their 20s would have to go to their parents or to older women to seek for these advices. However, if you delay getting pregnant in your 30s, most of your friends already by that point have kids of their own. They are already married just like you, and they have better insights to offer once you go to them for advice. Another advantage of delaying your pregnancy in your 30s, mothers admit that having children make them age faster. So if you get pregnant in your 20s, you feel very old already by the time you get 30 because you have, let's say, a teenager by that time. However, comparing it with those women who delay pregnancy in their 30s, by then they only have like younger children, which makes them feel a lot more younger than their peers. Researchers also have shown that those women who delay pregnancy to their 30s are usually those who have higher educational attainment and higher income. Women in their 30s have higher energy levels, better fitness, and fewer aches. It is also said that they have longer patience and that they tend to punish their children less. Another interesting advantage of delaying your pregnancy to your 30s is that they say that you are more likely to live longer. A 2016 study found out that your chances of living up to 90 years old is higher for women who delay their pregnancy to their 30s. I have talked about the benefits for the mother. Let's now talk about the benefits for the child. Advanced maternal age is associated with decreased risk of accidental injuries. A study in the UK showed that older maternal age at first birth was associated with fewer hospital admissions, fewer unintentional injuries for children up to the age of 5. It is also being said that those children of older mothers have higher chances or higher likelihood of being better educated than their peers born to younger women. It is also found out that these children have fewer emotional, social, and behavioral problems. Other researchers have shown that those children born to older mothers has increased psychiatric health, language skills, cognitive ability, and fewer social and economic difficulties later in life. They also say that these children are generally just healthier. As we have seen, as in any age group, there are the pros and cons of getting pregnant in any age that you prefer, be it in your 20s, your 30s, or your 40s. But I'm specifically in my 30s right now. That's why I'm sharing with you a little research that I did on the pros and cons of getting pregnant in your 30s. So let me know, what age are you in right now? Are you pregnant already? Do you have kids already? What age did you have your first kid? And why did you prefer to do so at that age? Let me know in the comment section down below. So I hope you picked up something in this video of mine for today. If you haven't done so, please do subscribe to my channel. Give this video a big thumbs up so it would go higher up in the YouTube ratings and it will be able to share more information to more women around the world. So thank you so much for joining me today, guys, and I will see you in our next video. Bye!